G'day and welcome to Choosing Your Uni. I'm Rob Wilkin. In today's episode, we're in Kakadu, specifically at Cahill's crossing. I'll tell you a little bit more about what's going on here in just a minute. But in this video, we're going to be talking about health insurance that you need, the Overseas Students Health Cover, OSHC, which you need in order to come and study in Australia. By the end of this video, you're going to understand what OSHC is, how you can get it, what other sorts of insurances you might need while you're here in Australia, everything else you need to know.
How good is this?
Yeah, it's awesome.
Well, this is Ubirr Rock, and it's one of the standout places in all of Australia to come and watch a sunset. Yeah, you can see why. What an extraordinary landscape. Anyway, OSHC, let's talk about that. OSHC is the Overseas Student Health Cover, and essentially here in Australia we've got public health care, which is called Medicare, and the idea behind OSHC is to give international students and their families and dependents, so kids, comparative sort of care to Medicare. So you can go and see a doctor, you can buy medicines, you can get some treatment in hospital depending on what the treatment is, emergency care, things like that. Comparative cover to Medicare, but for international students. Now, yes, there is a cost to this, it's fairly hefty, and I'll drop a link below to a page where you can find more information about the various OSHC providers, because you can choose an OSHC provider. In some cases, Australian universities will help you to choose a provider and will negotiate discounts for students in bulk, and the idea is that you buy that insurance cover so that you have that basic medical coverage when you're here in Australia. It's important to note that OSHC cover is not optional, it is mandatory. And when you are signing up for your program here in Australia, before you can be granted your visa, you need to have purchased your OSHC cover. Same thing goes if you want to extend your time in Australia, you want to extend your visa, you are going to need to have that insurance coverage while you're here before you can get that visa. So it's something very, very important to get organised. Now guys, it's super important to know that OSHC cover is not comprehensive insurance coverage. And so if you get sick and you go to see a doctor, here in Australia we have what's called the gap, the dreaded gap. And basically it's when a doctor decides to charge more than what Medicare or OSHC will reimburse. In that case, when that occurs, you have to pay this gap charge. And the gap can occur when you're going to see a local general practitioner, a GP, doctor, when you're seeing a specialist, when you're going to hospital, when you're buying medicines, pretty much everywhere you can have a gap. And OSHC does not cover the gap, which means, unfortunately, sometimes even when we go to see a doctor and we have that insurance coverage, we do have to pay a little bit extra. OSHC isn't the only insurance coverage that you might consider getting when you're in Australia. As I've been saying, it's only really equivalent to our public health system. So you can also get an additional private health coverage when you're here in Australia. There's lots of different providers of the private health coverage. And what private health cover allows you to do is to go to private hospitals to see some of those doctors that might charge a gap fee. They might cover some of those extra fees, and it covers a bunch of other stuff too. But it's very important for you to check exactly what you're covered for and to make sure that you're happy with your level of coverage. For example, some of the OSHC providers won't provide, or in fact, they will not provide coverage for pre-existing conditions for a couple of months. In some cases, after you get to Australia, sometimes not at all. If you fall pregnant, or if you are already pregnant and you come to Australia, your OSHC won't cover your maternity costs for at least 12 months. It's not very helpful if you're going to have a baby inside 9 months. So you really need to make sure you understand the coverage that you've got and that it covers you for everything that you need. So whilst a provider might encourage you, like a university, another institute might encourage you to take a certain type of OSHC coverage, make sure you read the details of what you're paying for, because in the end, that could save you a lot of heartache and a lot of money. Outside of your public health coverage, your OSHC, and potentially buying private health coverage, you might also need things like travel insurance. If you're traveling around Australia, that covers you for things like cancellations. If you're sick while you're traveling, it can actually cover you quite significantly. You might also need things like car insurance if you're buying a vehicle while you're here, and you might also need stuff like home and contents insurance. So all that stuff that you bring from overseas and you keep at your house isn't necessarily covered for insurance if it's stolen, so you might want to consider getting coverage for that too. Well, this stop is Cahill's Crossing. This is the main causeway, the main road, which goes from Darwin essentially over into Arnhem Land. Arnhem Land is Aboriginal territory where you need a special permit in order to get in here. And you can see the water starting to go across the causeway here. That's because at high tide, the causeway is covered. And what we're going to see in just a few minutes is some very large barramundi swimming over the causeway, and something's waiting for them on the other side. You can smell them. That's the crocs. You'll see these guys down here. This fella down here had his feet in the water just a few minutes ago. There are people killed here from time to time, so you wouldn't catch me putting my feet in there, but hey, that's Australia. We're not all good looking and intelligent. We've got idiots too. This is going to be awesome.